I'm Dr. S.K. Gupta. I'm going to talk to you about diabetes and corona infection. You all must be reading in newspapers that diabetes is one of the biggest comorbidities in patients with COVID-19. And diabetes is a risk factor for severe COVID-19 and the risk of hospitality. But you must be surprised to know that diabetics are not much more vulnerable to develop corona infection, meaning thereby that coronavirus cannot distinguish a person if he is diabetic or not. And if a diabetic can save himself from the society, from the people who are infected with coronavirus, coronavirus is not going to come to him finding that he is a diabetic and infect him. Is it not surprising? Because corona cannot distinguish a person whether he is diabetic or non diabetic. Yes, of course, once a person contracts a disease, a diabetic is likely to have a much more serious disease and a high risk of hospitalization and a high risk of mortality than non diabetics. Let us analyze the word data about it, which shows the prevalence of diabetes in general population and in patients of COVID. You see that general population, the incidence of diabetes is 10.2% in USA, and it is the same in COVID patients. It means that the coronavirus is infecting humans at large and it is not distinguishing diabetic versus non-diabetic. Now let us try to see the graph of COPD patients. The general prevalence of COPD is 11.3%, while lesser number of patients are getting affected in COVID and only 8.5% patients they comprise the patients of COPD in COVID-19. Studies from the China, in the first study of 52 patients, you find that 22% of the 32 deaths had diabetes. Another study of 173 patients with severe disease, 62%, 16.2% had diabetes, while in another study of 140 hospitalized patients, 12% had diabetes. It means the most frequent comorbidity in COVID-19 are hypertension and diabetes. In most of the studies, more than 50% patients who died of COVID had a combination of two or more conditions. This slide shows the data of Indian patients, about 109 patients, as on 7th of April 2020, released by the Ministry of Health and Family Welfare. And it shows that all of those patients who died, 56% had diabetes, 47% had hypertension, and one third of the patients nearly had hypertension and diabetes both. And asthma and the chronic lung disorders represented 20% of all those who died, and 16% had associated cardiac diseases as comorbidity. And this data nearly matches the word data. This slide shows that it is the combination of comorbidities which is a more severe harbinger of death in patients with COVID. And this slide shows that more than 40% patients who had two or more comorbidities constituted the death burden, and nearly 18% patients who died of COVID had three or more comorbidities. Comorbidities can affect even the young people in COVID-19, as this slide shows. In age group less than 60 years, out of 37 deaths, 86% patients had comorbidities. Usually, the incidence of death is high in patients with age more than 60 years, But even if the young people have comorbidities, they are having a higher risk of death because of COVID. Diabetics, as such, are not vulnerable to develop corona infection, but once they develop COVID-19 or corona infection, they have twofold increase in the incidence of getting admitted into ICU and about threefold higher chances of death in comparison to the normal population. This slide shows that there are hypertension, diabetes, cardiovascular disease in the world. It is the diabetes which is the most important, and around 20% patients have hypertension also, and cardiovascular disease represents 16% patients. And surprisingly, the chronic lung disease represents only 6% of the total cases of COVID in most of the cases. And it is surprising because COVID-19 is a acute respiratory illness, and it is expected that the previous comorbidity of chronic lung disorder should predispose to a severe disease, and more cases explains the increased risk of diabetics towards a severe disease. You all know that the diabetics have a impaired immune response to the infection, both in relation to cytokine profile as well as immune responses including T cell and macrophage activation. Secondly, the poor glycemic control in diabetics impairs the several aspects of immunity, and it leads to viral infection and the potential of secondary bacterial infection in the lungs. And thirdly, many of the diabetic patients are obese patients, and you all know that the abdominal obesity characterizes the low grade inflammation and secretion of adipokines and cytokines like TNF alpha, which also impair the immune responses. Also, the severe abdominal obesity compresses the lung bases, leading to the respiratory problems and decreased ventilation of basal lung tissue. Also, the late complications of diabetes as chronic kidney disease, ischemic heart disease lead to multiple comorbidities and make these patients much more frail, thereby increasing the severity of COVID-19 disease. Also, the patients of diabetes and hypertension are often on treatment with angiotensin converting enzyme inhibitors, angiotensin receptor blockers, and you all know that the coronavirus binds to the target cells through ACE2 inhibitors, which are expressed on the epithelial cells in lungs, blood vessels, kidneys, heart, and in the intestines. In patients who are treated with the ACE inhibitors and the ARBs, the expression of ACE2 receptors is increased, and therefore it is also suggested that this may also lead to more infection in patients with diabetes and hypertension, especially those who are being treated with these drugs. What should diabetics do to prevent the infection of coronavirus? The first and the foremost important thing is that they should maintain a good glycemic control, and they should very strictly practice social distancing and even the house distancing. They should remain away from the young people who have more chances of getting asymptomatic infection. While even in the house, these patients should maintain distance from their younger ones who have been going out, and they should very strictly adhere to the standard hygienic practices like hand washing, repeated hand washing, avoiding touching their eyes, nose, and the mouth, and the cough etiquettes. They should avoid stress, and the stress is very common among diabetics, particularly in the cases of in the days of lockdown. They should engage into various stress relieving activities like meditation, music, light exercises, and anything which they feel makes them happier. They should try to maintain social contacts through the internet, telephones, and other media, and they should never forget to do regular exercise at times because these patients are not able to move out. So they must make exercise protocol inside their house and do the exercise for about 45 minutes a day. This slide shows the management strategies in case a diabetic suffers from COVID-19. As most of these patients are likely to have a severe disease, sulfonylureas are the potential drugs which can cause hypoglycemia. So these patients, they should be stopped on any sulfonylureas. Metformin should be stopped. SGLT2 inhibitors should also be stopped in cases of moderate to severe illness. Instead, the DPP4 inhibitors, like linagliptin, can be used because it does not have any risk of hypoglycemia, especially in patients with moderate disease or mild disease. The long-acting GLP-1 receptor agonist, they have a long action, and at times these patients are eating pretty low because of the repeated vomiting, fatigue, and malaise. So these drugs should be preferably avoided. But once these drugs, once the injection has been given prior to the admission in the hospital, this cannot be taken away, and so their blood sugar should be monitored repeatedly. Most of the patients of diabetes would require insulin, and various hospitals have various treatment protocols, and all the efforts should be made so as to achieve euglycemia in these patients so that they recover soon. This is the real silver lining for the diabetics. It is a good news that none of the patients less than 25 years of age with type 1 diabetes has ever suffered from COVID-19 all across the world. So these young patients, they should try to keep their blood sugar in control with insulin and keep happy, but nevertheless follow the social distancing and other standard practice hygiene to avoid the corona infection. Thank you very much.